Welcome to the Talking HealthTech podcast. My name is Peter Birch. Today on the show, I'm joined by Shelley Thomson from Patient Experience Agency, who are THD Plus partners and part of the Talking HealthTech podcast network. So it's great to be here in the virtual studio with you, Shelley, a fellow podcast host, part of the family. Wonderful to have you on the show.
Thank you, Pete. I'm excited to be here.
Actually, now I think about it, we haven't done one. We've done so many variations of conversations in different parts. I'm not sure we've done a dedicated focus conversation on the podcast, or if we have, it's long overdue. So we've had plenty of conversations out and about at events. I've seen you've been busy and plugging into all parts of the ecosystem and in the THD Plus community, but wonderful to be really diving deep into your area of passion today on the show. For those unfamiliar with Patient Experience Agency, it'd be wonderful if you could provide a bit of context and an introduction and tell us a little bit of who you are and what you do.
Thanks, Pete. We're a human-centred design agency, so that's helping healthcare teams co-design really more human-centred, outcomes-driven care. That's really what we want to see. We want to see the healthcare system evolve. And we started Patient Experience Agency because we saw a gap. Patient feedback was being collected. I'm sure all of your listeners are collecting patient feedback, but it's not always meaningfully used. And we wanted to move beyond what is sometimes tokenism and support services to genuinely embed consumer and carers in a way that drives lasting human change.
Yeah. Look, it's something that we often easier to say and more difficult to do in the digital health space. And some may say, well, it's not difficult to do. We ask patients and we get feedback. And yeah, we do all of this. We get it, Shelley, no worries. But I feel like that's a little bit surface level, that the approach that we take within the ecosystem, because if we were getting it right, then there'd be a lot of these problems that wouldn't be addressed. Help me understand a little bit more about like what that looks like in terms of how you know, the types of organizations you help and the types of services that are provided. What does that, get a little bit more about the why, but like what does that actually look like?
Yeah, I think one of the things that we recognised when we started the business was that there was a lot of focus on reform and value-based healthcare ways of working in the public sector. And so people there generally are more aware of what's coming down the pipe, so to speak. But we're pretty passionate about making sure that the primary care sector also moves along and is aware of it. I mean, a lot of small practices out there, hundreds and hundreds of them, actually just got their heads down doing great work every day and may not be aware of what's going on. So we kind of set up the business to really say, hey, how could we help those people do what they want to do and be aware of what's coming, but in a really super simple way that's easy to implement. So, you know, for us, to answer your question, Pete, you know, we work in primary health networks, so PHNs, allied health, specialist organisations, general practices, nurses, health professionals, but and across the board. So we do work with state and federal government, but our real passion is primary care. Let's get that rock and rolling.
And I've heard you use the term loudly and proudly, the nothing about me without me concept, and I'd love to understand what that means to you, because if I reflect on this too, not to kind of cascade it to be a multiple pronged question, but in a themed thought I have, even at that, like, I feel like some people might go, okay, cool, yeah, I get that. And I feel like we live those values anyway. And so sometimes we might be getting to a broader topic here, but this concept of patient experience and getting patient voice and bringing it in, it can be difficult. It's not a binary, yes, we do, no, we don't. It's almost like levels of acceptability, and organizations might think they're doing it well, but in fact, they're, by some kind of measure, they aren't. So help me unpack that thinking first, and maybe we start with that phrase that's that all-important phrase.
Yeah, I think that nothing about me without me is a really important phrase. I know we hear it bandied around a lot, but it actually means that patients and carers are involved in shaping services. So they're not just asked for feedback after the fact. It's co-design. It's not just consultation at particular points in time. So they really help to define the problem and create the solution.
Yeah. And then, so like the co-design process and co-designing with patients and getting that feedback and involvement, kind of like I alluded to earlier, there's varying levels of and degrees in which you can do that as well. I know that people use, and this is where we start throwing around terms like PROMs and PREMs and patient-reported outcome measures, patient experience measures. But I mean, there's surveys and other things too. What are these mechanics to be at, like the things that you do in order to get that voice into solutions that you're building?
Yeah, I think it's important to recognise that consumer voice comes in lots of different forms, right? And you've just mentioned feedback and surveys, and even Net Promoter Score. Those sorts of things are really important because they give us information, but we have to recognise what sort of information they're giving us, and that is telling us how are we doing as a service. So that information, when you give it, is a little bit more about, are you satisfied with the service? Typically a customer satisfaction survey. So that's that information, and very important, but understand what it is and what it's used for to improve our own services. When we're talking about patient-reported measures, we're talking about how are you doing? How is the patient doing? And that's a different question that we're asking, and we should expect a different response. So, I think it's really important to understand the difference between those two things. We should be collecting a lot of data around patients, and for all of us in healthcare, patient-reported data is actually the missing data set, because there's no shortage of data, right? There's a lot around systems and how our services are going. Certainly a lot about, if you like, clinician-reported measures, so the clinical outcomes that people have as well. So we've got an enormous amount of data we collect around there, but we don't actually have consistent data around, as a result of the services we deliver, is the patient improving? Right?
Yes.
That's the missing data set, and that's where patient-reported measures come in.
Yeah, it's almost like we put it in the same bucket, those questions asking how are we doing versus how are you doing? Yeah. And that's there's a important delineation when you kind of spell it out in that way. But I think organizations and just busy founders and those in the doing phase of building can often kind of blur just asking questions for the sake of, I guess, getting patient feedback or consumer feedback. So what does the implementation kind of look like in obtaining feedback on either side of getting that kind of loop of information? Because in many tech companies, they've got a product roadmap, and maybe that's it provided, inspired by feedback and suggestions of improvements to solutions. They're building solutions because they've told investors this is the thing that we're going to build, and they've got issues to build. And somewhere you got to plug in, well, we're implementing patient-reported measures and other kind of surveys. Like, are these just fancy automations to trigger off an email to a thing and hope some people reply? I hear of some organizations that right up at a board level will lead with that kind of information. Help me understand how you integrate some of this feedback loop into companies big and small.
Yeah, I think really important, and I know, many of your listeners are very familiar with the layers, if you like, or levels of the healthcare system. There's that individual layer where there's a relationship between an individual patient and practitioner. Then there's the systems or service level, delivery level layer, and then there's the overall population health, or, some people call it a macro layer. I think the consumer voice needs to be different at each one of those levels. So if you think about, I'll talk specifically about the clinician and patient, that personal relationship or individual relationship. That's where patient-reported measures really start. So if you get that right and the collection of patient-reported data at that level, then you can aggregate up. But, a lot of people talk about the fact that if you get poor data at that level, then it's poor data all the way through the system. And I think really important too to emphasize that wherever you're collecting that data or whether you're aggregating it up the system, just collecting the data isn't enough, right? It's actually the real impact for all of us is what happens when clinicians use that data, right? And it's used in a really meaningful way that makes a difference to the outcomes for both the clinician in terms of, really proud of the work that they're doing, and for the patient, as in it actually improves their health and their well-being as well. So I think, when clinicians at that individual level start to use patient-reported data to guide conversations, to tailor care, improve outcomes, that's that real shift that we're talking about the how are we doing at the clinic, or the practice, to how are you doing at the person. And that's where you're really starting to see human-centered, outcomes-driven care take shape.
Well, my mind goes to just the amount of data we capture, as you alluded to before, and the reports we look at, be it in a tech company or a PHN, like any institution, even if you're inside or outside of healthcare. Or, often people talk about, we just run these reports because that's what we do and look at them every month and go, well, that went up or that went down, and we'll continue to do what we do. Often we then justify, that's hit down here, but you know what? They don't really know what they're probably using different language, but it almost feels like sometimes we continue to operate the way we do in spite of the feedback that we receive. And so often if we're so focused on achieving a particular goal or a vision or working within a budget or all the different constraints that happen within any kind of business, it can almost feel like a distraction, I guess, which is a weird way to put it. But if you think about, if you're on a clear vision and a path, and you're as an organization looking to do a particular thing, and the feedback you get from patients either at an individual level or about how you're doing is in conflict with that can be a tricky thing from a company's point of view, because I've seen many organizations take an approach of, well, almost like saying, well, maybe they don't know what they want yet, and if we continue to build this thing, they'll come around. So I feel like there's a cultural element probably too in all of this too, that you can put all the effort into building the things and then hope that people give you the, at IKEA, they got the 5 smiley faces and there's the big green one. I always wonder what they do with that. Like, what happens if someone has a say? Anyway, but you're hoping that you've got the smiley faces so you can use them for testimonials and things. But then what happens when you get all the bad feedback? I guess culturally, you've got to embed, like, if we're going to ask, we've got to be ready to do something with it.
Absolutely. And the worst thing we can do is collect information and do nothing with it. Absolutely. So, I suppose back to your IKEA example, the 5 smiley faces. It's really important that if we're going to collect it, we do something with it, but also we should be transparent about what's not working. And I think that this is a big cultural shift for healthcare. We're very nervous about that. And whether we like it or not, there are independent rating and review sites. Of course, there's Google reviews. There's lots of ways for consumers to find a way to have a voice if the practice or clinic or service doesn't provide it themselves. So I think most important to understand, and we see it internationally as well, there is a groundswell, a real shift in consumer empowerment. And that genie is not going back in the bottle.
No, and it made me think too, and even, you touched on, look, there's independent review sites and things where they provide it in neat little stars, and again, that's a metric that an organization that may not have control over what people kind of, rate on, but at least they can kind of see it. But I think a lot of the activity that happens, that people place a lot of trust in, is within communities they trust, and a lot of those are online and are on social media, and that user generated content that has when people are missing looking for information and they're looking for places they can trust, and that trust is then kind of welded into the social media, and it's all in the comments and the threads and the things that happen. So a lot of this stuff is out there in the ecosystem. It exists regardless of whether you ask the questions or not. So you may as well ask the questions and be upfront and transparent to be able to capture.
And I think it is about being proactive rather than reactive. I think what scares a lot of clinicians and practice managers at the moment is the Google reviews, the stuff that's out of their control at the moment. And what I would say to that is actually take back control. Ask your patients first, be on the front foot. And, you patients really want to help a service improve, even if they didn't have a great experience. The one thing we hear consistently over and over again in the work that we do is that people know that it won't be fixed for their experience, but they don't want anyone else to go through the same experience they did. So people are incredibly willing to improve things for the next people coming through. It's quite altruistic.
Yeah. If I think about from that individual's perspective, then that if we were to do things right, and particularly in healthcare, every healthcare interaction that a clinician provides is going to be different because every patient's needs are unique, and we have different cultural requirements, demographic, all the different factors that come into play when you look at a person's individual circumstances. That can be difficult to then factor into putting a hard measure around it, I guess, when I think about it. And I'd love to hear from you about like how we, and again, coming back to like, well, what, not just measuring something, but what we do about it. So what does it look like when we actually get the personalized care bit right for individuals based on that, considering all of those external factors?
Yeah. Personalised care it doesn't need to be difficult. I think it's care that fits around your life, right? Not the other way around. So it's not about asking what matters, what matters to you in terms of your clinical requirements. It's what is most important to you in your life. And so the clinician then, if you're asking those sorts of questions, can respond with support that actually reflects goals, around life and values and needs in that moment, and that personalisation that you mentioned, Pete. I think from the patient's perspective, that personalised care, it is a shift for all of us, whether we're clinicians or transformation, people in charge of large projects. It's moving from what's the matter with you to what matters to you. And that's a little mindset shift. You don't think that's massive, but it is. It's a whole different perspective. And now it's about what matters to you is your needs, your goals, your capacity, varying. And it's based on your condition, your point in time, your stage of life, anywhere along your care journey. Yeah. It's about seeing that patient first and a person first, really, not just a patient or a group of conditions.
And sticking with delivering what matters to patients, and I love that phrase of what matters to you instead of what's the matter with you. But the from a clinician's perspective, there's a number of different ways they can obtain information and communicate information to. I think we were talking earlier before we recorded about different frameworks and stuff that exist too, and the support you provide through patient experience agency. Tell me a little bit more about some of the options there for clinicians.
Yeah, I think really important for us to understand that clinicians are clever people, have done an enormous amount of training and are the experts in the clinical side of medicine. And patients have a lot to learn from that expertise and really value their opinions and their knowledge. But I think what we all need to do throughout life is be curious and continue to learn. We need to be lifelong learners because our patients are evolving. We're all evolving as humans, and clinicians are no exception. So what we do at Patient Experience Agency is we actually build programs to support people to change, and it's the human aspect of the change. We know there's some incredibly shiny and bright and exciting things that go bing in terms of tech platforms, and there's lots of systems, but quite often we're guilty of leaving the human change behind or thinking of it as a secondary thing. But in fact, if we help the humans to change first, then obviously we all win. We all get to receive the outcomes that we want. So our programs are all about human change. And so we deliver a lot of online programs, which are all about our newest program that we're about to launch is called Delivering Personalised Care. And it's all about implementing patient-reported measures into your daily practice, the way you consult, and helping you with that human shift associated with that. So we're pretty excited about that program.
We'd love to learn a little bit more about that, actually, because, so implementing patient-reported measures into, the day-to-day. Some clinics or clinicians may take an approach, well, I know how those work, and I know how to do them, in inverted commas. I guess there's a difference between training someone on PROMs and PREMs or whatever versus like deeply embedding it within the way you do things. Am I kind of on the right track there?
Yeah, I think, like we're really just talking about an evolution. I don't think at any stage anybody's not doing things correctly, and everybody wants to deliver, person-centered care. But I think if you look back historically at that evolution, in the 1950s, 60s, etc., healthcare was pretty paternal. The doctor knew best, and, it was pretty one-way conversation. Really, the doctor told you what was going to happen, and you either did it or you didn't. And so that really was that point in time where we're at. Of course, we've all evolved, and, patient-centered care is the kind of been the buzzword for the last decade or more. And that has put the patient at the centre is sort of the phrase that's used, and the clinicians around the outside, if you visually think about it. But really the clinicians haven't changed largely the way they operate. It's a two-way conversation because, of course, the patient is now in that and is at the centre of everything that we talk about. But in terms of the way clinicians work on a daily basis, clinicians haven't really changed a lot in the way they work. The Australian Commission on Safety and Quality in Healthcare has recently released a new standard, which is called Partnering with Consumers. And so that is leading to a shift in the evolution. So again, it's the next step, if you like, that everybody has to take. And that is a true partnership approach. And what that requires is another shift in the way that we all operate, where the patient becomes a true member of the care team. So a true partner in their care. And so you hear a lot of buzzwords around that. But in essence, what it means is we actually all do a shift. So the patient has to step up a bit as well as the clinicians, and we need to operate a bit differently because patients, whether we like it or not, we're all patients at some point, and we spend 99% of our time living with our own conditions and managing it ourselves. Now, that lived experience is incredibly valuable. And so that needs to come into the conversation. So that's part of what the Commission calls shared decision making, making sure the clinician knows how the patient is managing their own health outside of a consult situation. And then the patient needs to know what the options are for care and treatment or the pathways forward, so that they can create that shared decision making environment.
I'd love to understand what this looks like in practice, or like some examples of implementations. I know you were telling me about there was a pilot that you've run back in 2024. Tell me a little bit more about some of the real world examples of implementing some of this.
Yeah. So something we're very passionate about and incredibly fortunate that we partnered with the Allied Health Professions Australia, so AHPA, and we were fortunate to win a TAC, or Traffic Accident Commission Victoria, value-based healthcare grant. And so in 2024, we spent the year doing a pilot, which helped clinicians transition to this new model of care, this new way of working, value-based healthcare, and implementing patient-reported measures. And what we were able to show was that there a 14.9% increase in patient experience maturity amongst practitioners who actually took part in our structured learning and our peer support model. So we could show an uplift there. In contrast, we also ran a control group throughout the year, last year, and who tried to implement those same changes, but they were to do it on their own. So they didn't do our program, and they actually declined by 6.9% over the years. So I think the reality of discovering it wasn't as easy as they thought actually took hold throughout the year. And we saw that those participating clinicians that did our program actually enrolled 5 times as many patients into patient-reported measures as well. So that really starts to show how effective a program like ours is in driving scale, but also sustained behaviour change, because they did adopt it and sustain it for all of last year throughout the pilot. So for us, what that really means, it really reinforced that the value of our programs and our approach is, it's a practical, scalable model that works across disciplines, and it helps teams to really fast track, accelerate that truly personalised care that they want to deliver.
Oh, that's a powerful example. And I guess I think for any organisation, it's seems pretty logical if you're serious about improving and demonstrating that you take the patient voice and patient experience seriously, and it's embedding it in part of what you do, trying to just do it in amongst all the stuff you already do without that kind of external assistance. It allows you, as the research shows and the example shows, it can be almost detrimental. I guess there's a lot of things happening in a business on a day-to-day, but to be able to bring in the experts and have that focus and build that capability, I imagine too, it's a bit about building the foundations and getting the capability right, so that then it becomes almost part and parcel, and this is just the way we do things now.
Yeah, absolutely.
And hey, if I was an organization that's looking to, start now and start thinking about how we begin to implement more voice of, like, bring in more voice of the consumer into what they do on a day-to-day, is there any kind of key takeaways or hot tips or things they should be thinking about and something they can implement?
Yeah, I think the easiest thing to do is just ask that one question that we've talked about, Pete, which is, what are the outcomes that matter to you? That's my one tip, and just genuinely listen to the answer. There's a whole framework around how to listen, to what people say and respond to in that situation. But that's my hot tip for you.
Yeah.
In terms of upskilling, jump on our website and have a look at our programs. Certainly that delivering personalised care is for individual clinicians, anyone in healthcare that wants to upskill in this new way of working. If you'd like, as a practice level, you'd like to deliver a patient experience strategy, we have a program for that. But if you're just curious about it and you're not quite sure whether it's for you, I suggest you go and listen to our podcast to start with, which is, of course, Pete, we're in your stable of podcasts, but Consumer Health Partnerships, and take a listen. There's lots of different episodes around bringing consumer voice into research, into clinical service design, into co-design, that in primary care at a hospital level, at a state level. So there's something in there for everyone. So I highly recommend having a listen to an episode or two.
As do I. But and you will find on the audio feed of the Talking HealthTech podcast, there would have been a few bonus episodes scattered out throughout the feed where we've played a full episode in its entirety for you to get a bit of a sneak peek on what it's about. But there's a whole series in there in the feed of the Consumer Health Partnerships podcast that you can go and check out. So the link will be in the show notes of this episode and the details below, but also all the information in relation to Patient Experience Agency and the new program that's been launched at the time of this release as well. So jump in, have a look, and connect with Shelley and the team to learn more. But always a pleasure to have a chat here on the pod and out and about. So thank you so much for joining me on the show today.
Thanks, Pete. Pleasure. Great to see you.
We hope you enjoyed this episode of Talking HealthTech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.